like, oh my God, what are you taking from me?
Yeah, yeah, yeah. They'll ask so many questions. Will I be okay after that? That's where the hormones kick in, and then the stress enzymes or hormones go to the brain, and the vagus nerve takes to the brain, and they faint. Yes, Varna?
Sometimes also the patient will ask when is the test result will
Yeah,
get like that.
that's natural. That's because they want to know, curiosity. Why they come there? If someone is normal, they won't be there. If nothing is happening to them, they won't be there. Something is happening in the system. They want to know what's wrong. They go to the physician. Only the physician is ordering those tests because they want to see what's happening. That's
Right.
why they are more panicky. Some people, when they see the tubes, I have noticed patients, even if you take 4 or 5 tubes, they don't ask anything. They know there's something, so they want it. They're very cool. They cooperate. Some of the patients, just by the word blood, they are done. It's a big thing. That's it. They are done. Okay? And because they don't have the idea that the blood has to be formed after 3 months as a fresh ones. Otherwise, anyways, they're going to die. The blood cells, they will be destroyed. So this is lack of information, lack of knowledge. So all these things matter. So you don't talk much. You don't have to give a beautiful lecture. Just tell them the procedure that you're going to do up to the point. Make them feel comfortable. That's why have a smile, greet them, talk to them, make them feel comfortable. Other than that, it's not your job to explain everything. And it's not your job to ask about their family, how many kids. We don't want the family history. We'll be seeing. So you will experience. You'll be tired dealing with patients all the time. You're doing your job. You just feel like, okay, let me get rid of this patient as early as possible. Let us wait for the next one, because you will be annoyed sometimes with the way they ask questions. Trust me. You don't feel like talking much, right? And the professionalism always kicks in. Otherwise, we will just throw some patients out. They'll be that annoying. But that's okay. That's human nature. So we have to be nice. Yes, Eveline, questions?
Um, I just want to share a patient before, ma'am,
I think
way
you
back
have to
in
unmute.
Philippines regarding. You hear me?
What happened to you?
Regarding a patient with Down
I can't hear
syndrome.
you.
Cannot hear me?
Wait a minute. Yeah, your
I
mic
can
is.
hear you.
Yeah,
I
what
can
is
hear.
I can hear.
I can hear
Yeah,
you,
I can hear.
Evelyn.
what
Thank
is she?
you.
Yeah, now I can hear. Okay, what's happened?
Okay. Yeah, a patient with Down syndrome
Yeah.
and having a chicken pox. And the
Mm.
doctor wants to know exactly if it's only anemia and WBC. So I have to collect a blood for
CBC.
CBC. Yes.
Mm.
So, well, the mom is there, and the Down syndrome patient is really
Hard,
crying.
hard.
Yeah, but it's really hard because he has chicken pox
Yeah.
all over his body.
Mm.
He's a man, he's a young man. And
Oh.
yeah, the relatives will also be there to assist. For
Mm.
example, for patient with cognition
Yeah, disabilities,
problems.
yes.
Yeah.
Someone has to be there for cognitive issues. It's always good. You will notice, you will find. Why we are talking about it, because we're going to practice next week in the lab, and you can also pretend, like you can role play. You can role play, so when your friend wants to take the blood, they want to know how it's going to be and all those situations. But believe me, that theoretically what you learn, the situation where and the outside world you will face will be different. It's not hard, but you should know how to cope up, and you will do, because you will be seeing others doing that. So naturally, you will be getting that, right? And our part of trade, that's why we shouldn't be distracted from the day one. while learning phlebotomy. I'm very strict about that. Yes. Okay, let's start. It's going to be very easy. So the communication can be verbal, which means using words, non-verbal signs, and active listening, which means every time you have to listen to them. But for some, you can answer. For some, you cannot answer. Yes, Ying Hong?
I was just wondering, like I was correct, the A troops in the September, like Kara said, so much blood you took from me, but I don't know. I didn't know the physician, like the physician didn't tell me I need to so much blood. So, yeah, so if the patient like at this situation, like the phlebotomist, how to turn them, make them comfortable, feel comfortable.
I'm missing your point. So
Sorry.
you're talking about autistic child, right?
I
Yes.
mean the blood poke. Yeah. The blood, like collect the A tubes blood.
Three
And
tubes.
A tubes, it's so much. But the patient didn't know the corrector need take so much. Like the physician didn't give the requisition, but the patient didn't know, right? She just talked to, I have some condition, and the physician asked the patient how to do test, right? But the patient didn't know so
the
much.
patient usually, they don't know what kind of tests are going to be performed. But the technician knows based on the tests, because we are learning this much. We know what they wanted to know based on the check marks that we are seeing in the requisition. Okay, he wants to know this, he wants to know this, he wants to know this. Now, slowly, based on your experience, you will also know what kind of disorder or disease this patient is having. Can you believe this? The first person to know about these things will be us, the technicians. But we have to zip our mouth. We can't talk much. By law, we shouldn't talk about the tests, the procedures, the results, but we will know. And we are the people who are going to take the blood, definitely based on the requisition, based on the demand, we will collect. That's our job. Slowly, by experience, you will know why they requested the test, what's going to happen. But the only thing is, we are not allowed to talk.
I think she mentioned from the
Is that what you want to know? Like so much blood is collected and the patient, they don't know? Yes, they don't know.
Like the patient, they don't know. Like the patient is not ready to take so much blood. Maybe she is afraid, and the needle something is like afraid of. Yeah.
So in that case, what we have to do, how we have to convince, is this your question?
Yeah, the phlebotomist as a technician didn't know wrong, as he based on the requisition to collect the blood.
Yes.
She didn't know wrong. But just the patient now like is not ready to so much blood. That's my question.
Oh, that's my question. That's okay, because well, first of all, if the patient is like feeling paranoid because of the blood, the tubes that you pick, distract them. Tell them not to look at the site.
Okay.
Tell them, okay, or talk to them something like how, for example, I would ask like, how was the drive, how was the weather, and all those things. Distract them. But if they are really, really like paranoid and they're so anxious by seeing the tubes, that's okay. But the test demands we have to do that. Because the reason is now technically the mixing ratio should be perfect in some tubes, and in some tubes, SST, for example, 10 tests can be done. And if I'm seeing in the requisition so many tests that's been ordered, definitely I
Yeah.
have to collect that much blood. But I don't have to teach them why I'm collecting, what I'm doing. You
Okay.
won't have the energy, and it's unnecessary.
Okay.
The patients will become confused. So distract them, tell them, okay, read a magazine or something, give it to them on the other hand. If they have phone, they can use it. Distract them. They don't
Okay.
have to know.
Okay.
Okay.
Okay. Let him like
Yes,
relax.
make them relax by distracting them. Even for
Okay.
the people with phobias of needles, that's what we do. Clear?
Thank you. Thank
Yeah.
you, clear. Thank you so much.
You're most welcome. So always depending on, that's why we have to read their facial expression. That's why communication is very, very important when it comes to phlebotomy. That's why I'm here to talk about it. Why? Because even while performing the phlebotomy, we are in the closed area. There are different spaces based on how you interact with a person. That's called a zone. As a social space, we call social space. In that space, we come under intimate space, which means we are very close. How close we are? We are taking even the particles coming out of their nose, their mouth. That's why we have to wear the mask to protect ourselves. We are that close. That's why during the COVID, our director for the ML POW, she mandated the ministry to make this as a controlled act, and we demanded some extra funding for extra money, a payment for the technicians, but it never happened. The government doesn't want to do that. The Premier Ford, he never accepted that. Because of this intimate space, she told the ministry to make some changes, or some sort of protection should be given, or extra money has to be paid for the technicians because they are doing the risky job. And we are doing the risky job. We come out of the intimate space or zone. So the study of an individual's concept and use of space is called proxemics. Underline this or take a note. You will be getting this in the final exam. Proximus. What is a proximus? Even for the ML POW, even for the CSMLS, you will be getting this type of questions. The space zone is very important. Okay, so effective communication in a respectful manner is essential because it will create a confidence, a trust in the patient's mind. So the patient will be more comfortable while sitting in the phlebotomy chair. Okay, if you want, we can role play. It's not a problem. Next week I'll be checking this intimate space, zone, how you talk, because it matters. And what is verbal communication? As we all know, talking using our mouth. Okay, why we are talking? Now tell me, if I'm coming here in front of the camera and then I'm showing gestures without talking, what will you understand?
Nothing.
Nothing. Why? This is how this has to be done. This is how it has to be conveyed. Similarly, a patient is coming, you just nod your head. What will the patient think? Okay, I'm here. Why she's nodding the head? It means for you, it may be like, get inside, please. For him, it's nothing. It'll be evaporating. So make sure, greet them. Hello, good morning. It's a way of making them feel comfortable, relax. Please have a seat. The next sentence, little bit more relaxed. Okay, now I'm going to perform a procedure where the doctor has demanded, or that the physician has demanded. He wants to see something in you. He has ordered these tests. Okay, next. Okay, a little bit more relaxed. Now in this procedure, I'm going to poke a little bit. This will be like little bit different for them, a poke. What kind of poke? Then again, follow the other communication way. No, just you have to stretch your hand. It'll be a little bit poke. Don't tell them it won't hurt. Yes, it'll be a pinch, but that'll be over quickly. But only thing we are concerned about is your blood to see what is going on in your system. So this will make him more confident. This is what we call the verbal communication, verbally talk. Now, then they will put some words. You have to listen to that actively. Active listening, not just listening. Just listening is like the way you listen when I talk. Active listening is alertly, they will you have to listen to them, which means each and every word that they put is important because the body belongs to them, the blood belongs to them. Of course, they will be concerned. You cannot say, oh my God, these questions. No, I know you are there to do the job, but they have to be confident. They have to put the trust on you. So they will ask questions naturally. So don't lie, tell the truth. A pinch, yes, but it will be over. We'll be taken care of. You don't have to worry much. That's it. Okay? You don't talk you don't talk your history, you don't ask their life history. We have no time, sorry. And important to prepare the patient adequately for the procedure. Tell them mentally, physically how you will be preparing. You have to tell them, okay, I'll be applying cotton. It'll be a little bit cold on your skin. I hope it'll be okay, and like that. Because we are going to do the procedure anyways. It's your role to educate the patient about the process in a respectful manner to ensure positive outcome and improve the sample integrity. Sometimes stress also alters the sample integrity. High level stress. We don't want that. This is not that bad. Right? Yes or no? This is not that bad. It's okay. Imagine a person is going to have a head injury. He doesn't even know, but accidentally he had a concussion and something got injured and he'll be in hospital. Those are the major things. We are not going to do anything like that. We are just going to draw the blood by making a poke. That's okay to be a poke. But you can't tell the patient these things. It's not like a big injury like breaking a leg, breaking a bone. It's none of a business to talk like that. Just tell them it's a poke. But actually speaking, psychologically, you compare the situations of injuries, accident injuries, horrible. Right? You guys don't talk.
Yes, ma'am.
If
Yes,
you're not
miss, we're
talking,
listening.
I'm not talking. So those situations are very bad. This is just a poke. How you will convey the message about the poke is a skill. Anyways, we want the successful poke. That's it. Give patients time to ask questions. Let them ask. It's okay. Some of them repeatedly they ask. I have patients like this. They come, they ask so many times, will it hurt? Will it hurt? You know, the people who come there who ask these questions, youngsters, youth. I'm so surprised. You know, the teenagers, 13 to 19, oh my God, they are so sensitive. They ask so many times, will this hurt? Yes, there'll be a pinch, but make your words precise, very precise. Don't elaborate. Yes, there'll be a pinch, that's it. But you will be overcoming this. Okay? Don't tell them it's not a big deal. Don't tell them, oh, many people are coming here, they do that, then why are you asking? No, 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 it's not our business. Because for you, it's not a big deal. For that boy or girl in that age, they are very sensitive. For them, it's a big deal. And some of them, they will ask, will there be a mark, a permanent mark? Why? Why permanent mark? Right? But they will ask. But you have to be all the time same tone, same pace, calm, friendly, making a positive, what do you call, an optimistic way of talking should be there. An optimistic approach should be there, even if they are negative with their, just the one poke. Just imagine, as a technician, sometimes I used to stand and think, oh my God, just one poke to take 2 tubes of blood. Is this a big deal? Yes, for them it's a big deal. Once I had a patient, she was crying, a college student crying. I'm preparing, right? And then I wiped, she was okay. And suddenly she started crying. She was crying, and then I have to wait for 10 minutes. She never stopped. And then I asked her, okay, calm down. Is anything bothering you? Are you coming tomorrow? No. Will it hurt? This is the next sentence. What can you do? Okay, go out. Call the next patient. Anyways, tomorrow the person has to come. That's okay. Let her cry, gives her some time, and then just tell her, are you ready? That's it. Okay, so this communication is very important in the phlebotomy job. Okay, that's why your skills with the phlebotomy should be so good that this shouldn't be a problem. These things you have to focus a lot because this matters. But this, if you're trained well, this is nothing you can handle. Clear? At this, when you go there, you're not thorough with your skill. Now this patient is asking too many questions and you're focusing on the tubes. You don't know which one goes where. Then it'll be a mess. Do you understand what I'm talking about? We don't want too many problems. Be thorough in one procedure that you're going to carry on in future. So make the other situations less problematic. It'll be easy for you. And give the patients time to ask questions, share the information, vital to sample collection. You have to just say the doctor wanted this because we as health professionals want to make sure that you are in good health. That's it. Anything positive, put there. Anything good words, put there. Make them feel comfortable. And post-venipuncture care information. What does this post-venipuncture care means? What do you understand?
After the venipuncture was done?
After the venipuncture was done, what is the caring there?
The cotton, the pressure on the arm.
Cotton, the pressure, and check for 15 to 10 minutes. Usually they say seconds, but I mandate like 5 minutes at least. They have you just double check the name till that whether it's bleeding or not. Are they okay after the phlebotomy procedure? Do they feel something different? These are the caring procedures. Okay, speak calmly, clearly, and directly to the patient using plain language. Don't ask them if someone feels nauseated. Don't ask them, do you feel like emesis? What is emesis? Another confusion. You know emesis, they don't know emesis. Do you feel like vomiting? If they nod their head, just give them the pen. That's what it's plain language. Avoid medical terminology, all those terms, because you are learning, you're okay. But what about them? Right? It makes sense? I'm also going to sit like this staring at you because I don't know what you understood. So you're not talking.
Yes, miss. It makes sense.
So now, effective non-verbal. So these are the way you speak is the verbal. What is non-verbal? Non-verbal means something that you use your hands, your gestures, your body language, all those things. You don't open and talk. It's also known as kinesics. What is kinesics or kinesics? They're the study of non-verbal communication. Body language can demonstrate confidence. The way you stand, the way you act, the way you pick. If you're confused running here and there, that shows that you're anxious. And it's like a chain reaction. When you're anxious, the patient will be anxious. And if the patient is anxious, the blood collection will be difficult. Okay? Maintaining eye contact is important. Observe the patient's behavior to understand if this makes them uncomfortable. What is one thing that I have noticed in the class, in the lab, that have made them uncomfortable? What could that be? I have noticed some students are not comfortable while doing the phlebotomy.
It's the tying the venipuncture sometimes. I know the tourniquet, I mean.
Tourniquet, the way they make the face, they don't have
Yeah.
to say anything.
Yes.
The face goes, it means something straining, something painful. They don't want to say because it's the classmate who's poking. Trust me. I just observed there the way it goes. The tourniquet is tight. Is it okay? Yeah, I'm fine. Go ahead. But they're not fine. The needle poke and the border of the vein, painful. Ouch. Sometimes just the body will be a little bit twisted. I know it's pain is there, but you ask them, are you okay? Yeah, I'm fine. Go. You're good. Not good. When I observe these things, I send them back to the artificial arm. But this is a training, okay? But in the real situation, can we take it so lightly? No, not a good thing. They will point out, oh, that technician, I don't want to go to her. And one person telling this, 2 people, 3 people, 4 and 5 of them telling, no, she's no good, man. I don't want to go there. Then the supervisor will hear this. She will call you. And you got the diploma. You have been assessed, you have been evaluated by the MLPAO, by the college, through the exams, practicums. You will be under pressure. Where did you study? Who taught you this? Why didn't you learn perfectly? So all those issues. So make your job perfect. Okay? Not with errors. Poking at the border, tying the tourniquet to pinch the skin, all those things. Try to avoid. Okay? Make the patient feel comfortable. Sometimes it's a cultural difference. Yeah, some people, I don't want to touch this topic. You will understand what I mean. Some people, they don't want to be poked by some other group of people, and all these things are still there. Just avoid this. Just ignore. Face the patient. Don't turn your back. Why? Because you will be thinking, okay, the patient is fine. You'll be turning, checking with everything. And then what happens? The patient will be sliding down. They may get hurt with the head. Head injuries can happen. Keep your body open, no crossed arms. This thing I have to tell you. You're doing the venipuncture using the right hand. And you have put all the your station is there, a little bit far away. If you're using this as a dominant hand, the left hand, if you're keeping all the other things towards the other side, now you're crossing your hand to get the tube, the cotton, the band-aid. Sometimes you get stuck. I have noticed this. You get stuck. Miss, can you please give that? Okay, miss won't be there in the real situation. Be careful. You have to make your area, your station comfortable. It's a big thing. And the patient notices that now the patient's anxiety will be increasing because The patient will be very close to you, and then he or she might be thinking, what kind of technician is this? She doesn't even know where to keep the things, and then she's now, the needle is inside my hand. What's going to happen? And the stress alters the test results also. So keep this in mind. Use respectful gestures. Don't use a finger that's not been required to use, which we consider is no good. Okay? And don't use your facial expression like you're annoyed, you're bored with that patient, you're irritated with the patient. Don't show your expression. You always smile. Be calm. Okay? Because it goes away. The patient shouldn't go and complain. The patient should go and complain about you. That you have to take care. Look professional. What does it mean? You're wearing a lab coat with spots on it. Your hair is not tied properly. You have such big nails with nail polish so beautifully decorated. It's good. But how will it look when you're like in a health profession? It's not good. Why? The nails may poke the other skin so big. Sometimes the nail can hurt the other skin. At the same time, the procedure that you'll be doing will not be, you cannot hold some things perfectly. The nails will be the hurdle. That's a hindrance in collection of the blood. So all these things you have to avoid. Clear? Even the long nails will be hurtful for you if something is broken or some damage happens. So we don't want to be in that situation. Avoid everything to the max and be up to the point in a very professional way. If the nails have to be trimmed, they have to be trimmed. And another thing with the nails, microorganisms who loves a human being, they'll be comfortably sitting in that area of the nail. You're making a broader space for them to land. And during this venipuncture procedure, maybe they can enter inside the skin. That's why we wash hands. But if the nails are bigger, the washing procedure may not touch the interior areas of the nail bed. So if you're doing the procedure, the microorganisms may be there and they can contaminate the site. Again, the patient will get the infection. So all these possibilities should be avoided. That's a big no. If I'm going for a wedding, a party, yes, I can do, right? I like colors. Colorfully, you can decorate yourself with different whatever you want to do, but not while doing the phlebotomy. Clear? This is what they mean, be professional. That's a big topic when it comes to professional, like how you have to look like professionally as a technician. The lab coat should be properly tucked. The buttons shouldn't be up and down. It should be white and clean. And then your hair should be tied properly. Because you're performing the venipuncture, the hair is loose and you are having a beautiful lengthy hair. The hair may fall on the patient's hand. Okay? It's disturbing for you and the patient. You may say sorry and then you put it back. By the time there'll be a moment, it may hurt the patient or some errors can happen. Tie your hair, look clean with a beautiful smile. No perfume. We know many people are allergic to perfumes. So this is a very big topic, guys. So this shouldn't happen when you are performing the venipuncture. So look professional. That's what it means. Active listening. The active listening is part of it. What is meant by active listening? Listening to what the patient is talking, whatever they ask. Stay calm, answer politely, up to the point, be specific in your terms. Don't put extra unnecessary words, a problem, right? You don't know what the patient will pick from where. You don't know. Because we will be seeing varieties there outside. Don't get distracted in your own thoughts. So now you're poking, but you're not here. Your mind is thinking, is my daughter will be picked up on time? Will my husband be going there on time? We don't want that. At that time, you focus on what's being done and what you are doing. Don't think about all those things. Today evening, I may go to the movie after the dinner, but I don't know what to cook. Can I make a lasagna? Not at that point. Not there. Clear? You do whatever you want to do. Once when you go home, you decide, but not while doing the phlebotomy. Pay attention to your body language. Be courteous and show empathy. Why be courteous? What does courteous means? Thank you. Then greeting them. Hi, good morning. Oh, if someone says, oh, I don't want a cotton or a tape, I want a Band-Aid. So be courteous. Okay, thank you. Put it properly. Okay. If they say thank you, respond. If someone is telling, okay, it's a little bit painful, don't tell, it's okay to be painful. I did it from the morning. So many patients know they don't want to hear that. Tell them it will be going away. Maybe I can use another Band-Aid. Let me check if there is any bleeding. Then do you need ice? If it's hurting, give them the ice. Like that. Show empathy. And sometimes hard to be consistent when you're collecting from a lot of patients. This is something that you have to have a control. Majority of them, they get irritated. There's so many questions, so many different veins, so many difficult veins also in one day, but this, you will overcome this situation. In the beginning, it will be a little bit tough. It looks like tough, but it's easy. If you have the passion of doing your job, you have already landed in this area. You have to make yourself comfortable by becoming a confident phlebotomist. Okay, acquire the necessary skills. Focus is the main thing. Then these other things definitely you can overcome. And you will see, you'll be surprised. Oh my God, is this the same person? Am I the same person when I started this? Yes, you're the same person. But the method we have used to train ourselves, the way we have put up our effort to be in this career makes you a great person. So when someone comes and says, oh, thank you so much, you did so good, how will you feel? You feel so good. And that feeling you won't be getting even after watching a movie, after eating popcorn, after eating a big dinner in a restaurant. When someone is approaching you, oh, always you do a good job. That's why I want to come to you. How will you feel? You feel so good. You'll be flying on that day. Because words are very important. It makes us go up. It makes us go down. So always be a person to be up. Try your best. Why not? We all can do that. That's why we are here. And remember one thing, if you do this as a service-minded attitude, it automatically comes to you. And with that comes money. Clear?
Yes, ma'am.
Yes. So what are the parts of the active listening? 7 steps, they say. These questions you'll be getting in the final exam. What are the 7 steps to active listening? You have to summarize, show empathy, means put everything overall in a content where it's easy for them to understand. Use open body language, paraphrase once again, tell them exactly the important points. Request clarifications, ask them, is it clear what I'm going to do? Okay, do you have any questions? You can ask, clarify. Ask open-ended questions. If you want to ask something, ask very clearly. Be attentive. Always be attentive what they're asking for, what they're looking for exactly when you're going to perform something. As a phlebotomist, I'm talking about. This is for general. This is for general active listening. But as a phlebotomist, what are the things you will pick up? Empathy will pick up. Open body language you will pick up. Repeating the information that you're going to perform, yes, it will pick up. Asking questions to them. You don't ask questions, they will ask you so many. You ask only the ID questions, identification, date of birth. That is important. Pre-analytical. Be attentive. Yes, we have to be attentive. Appropriate way to approach. It's easy with outpatients because inpatients are always in a horrible condition with some sort of disease, pain, already IV poked. So when you approach them, they won't be in a good mood. Don't expect anything from them. Even if they say thank you, it's a big thing. They'll be in such pain. They'll be irritated. They'll be frustrated. That's okay. It's their situation. Understand. And then if someone is like really abusing you verbally, talking so rude, unnecessary words, yes, you can talk to the supervisor because that is not accepted. If someone is like violent patient, that's not accepted. Of course, these things you have to report. Other than that, silly questions, that's okay. Some of them you can ignore. Some of them, yes, you have to make them understand. This you can do as an adult. And when outpatients are there, for example, if you're working as a phlebotomist in a Dynacare lab, in a Life Labs, it's easy to handle. Because they come, they walk, they sit on the chair, then they'll just, you ask them the ID and then you greet them and then you will do the job. They'll be walking and talking. In the hospital, a patient who's unconscious will be there. A patient who is like bedridden will be there. A patient with some sort of injury will be there. A patient with some sort of other conditions, mental health conditions will be there, admitted. If you become a technician there, how will you handle? It's all up to your personality. Make yourself or bring out your personality and reflect in a very calm way. You be a calm person. As once someone said to me, be a rock. Okay? It's okay. Because they don't know, you're helping them actually. That's why I said, if you are a service-minded person, it's good for this job. You're helping them. How you're helping them? By staying calm, quiet, at the same time taking the blood for some diagnostic purposes. Irrespective of what they show, the tantrums, everything. Okay, clear? Okay, when there are inpatients in the hospital, how will you approach them? You will approach them if there is a curtain. In the hospital, you know, we have curtains to segregate the patients. If the door is shut, knock. If the curtain is there, just give them a tone. I'm the technician. Can I come in, please? Are you okay with it? Then go check if the patient is sleeping. Go check if they are unconscious or conscious. Is the doctor inside? Is someone talking? Relative, priest who's there? Family, friends? If no noise, maybe the patient is in the bathroom. If it's a room, just knock. If you can't find the patient, don't scream. Just wait, be calm. Some patients, they don't like to respond when they are in the bathroom. Okay, so come back. Make a note, I'm the technician and you're nowhere to be seen, so I'll come back. If you have a doubt and if you want to make sure that the patient is not there, talk to the nurse. Look at the nurse who's in charge of that patient on that particular day. They'll be there, it'll be written. So talk to the nurse. I cannot see the patient over there. Can you please double check the patient? The nurse will go double check. Okay, he or she in the washroom or bathroom, come again. So you go again. Anyways, we have to draw the blood. It's our duty. We've been paid for that. And we all know in Canada, particularly in Canada, we have to work in order to get the bread on the plate. I'm telling this seriously. From the country where I belong, if you have a good income, if you have invested in properties where the income is coming, you don't have to go to work. I'm serious. You just take your bike or your car, go for a ride, enjoy the beach, and then go talk to your relatives. Majority of them are not working. Women, they don't go to work. So just hi, hello, how are you? When is the marriage? When is going to be this? When is all these things, right? And then you come home, you buy the grocery, and that's it. You're good to go. People are living like this. Trust me. People are living like this in different parts of the world, right?
Yeah, right.
That's very true, ma'am.
Yes,
Very
yes.
true.
Yeah.
We
You
can't
call
sit
them
around.
you call them in the evening. This is my experience, guys. I just want to take 2 minutes of your time. When I call them, I'm busy in a wedding. Oh, really? The weekdays wedding? Yeah.
Yeah.
You tell me, are there weekdays wedding here in Canada? No.
No.
No. Only
Yeah.
during the December time or the summer time. Then you ask where we are. We are at workplace, working in the hospital, working in the store, working in the company, working even at home, working from home. That is tough to get money in Canada. So definitely we will think about this. We have to do our job. Clear?
Clear.
Why
Yes,
would I
clear.
come here? Yes, because, okay, let me put it in this way. I came here because from the beginning, my grandfather was a physician. I have seen him camping, going to villages, doing that. He did as a service-minded person, not mainly to make money, right? And what I found, being from that family, my father is also the same. And me also, I somehow inherited that from my grandparents. Both my maternal and paternal side were like in service-oriented people. They ran a couple of charitable institutions, everything, and they did a lot of service. But what I noticed, the public, they never had a proper mindset. I mean, they don't know what's going on. They take everything for granted. In the country where I come from, they take everything for granted. But at that point, as I was growing up, I noticed so many drawbacks. For somehow, I don't know, that clicked in my mind. What these people are doing, wasting their time, right? Not focusing on the what do you call, the generations, just gossiping, talking. Few people ended up in my period. I'm talking when I was young. Only few of them, they went to get the higher education, even though they had money, comfort, everything. They don't like to study. This is chilling around type of communities we have still there. But now there are so many changes. By the time I was thinking, I thought, how am I going to live here? I want a community where it's productive and something has to be done. And the service has to be provided to the people. So I thought for a while. I was in a, my level of education was little bit higher, because always I focused on productivity in terms of acquiring knowledge. Even if I'm not doing this, I'll be doing something which is productive. That's me as a personality. So I found the whole American continent, the US and Canada, is heading towards that side. So I ended up coming here. I miss my family, I miss my people, everyone there. But still, this makes me, this attitude makes me like to proceed in a progressive way. And I enjoy this. When I go back for vacation, when I see people, this is what I see: chilling, talking, going around. Yes, this makes me happy. I'm happy to share what I have learned. I'm happy to share what I have just seen, but this is like a service to me, right? So it's up to the individual. It's all up to the individual. How some people, they don't want to work. They don't want to do anything, just chill. Clear? So always knock before entering or make your presence known before pulling back the curtain. The curtain is part of the patient's privacy, which they don't get much of in a hospital. So in a hospital, yes, not many of them are blessed to have a room, especially when you go to emergency where there are more patients. You know, the segregation part will be just a curtain. And before that, just make some sounds to let them know, the patient know that someone is there. Tell them I'm the technician. Can I come in? Can I get inside? So that makes the patient feel respectful, honorable. They feel confident in them. Clear? And sometimes the doors are left open, but still knock the door. Introduce yourself. Now, can you tell me who is in the image? Is the patient? Who could that be? Who's the physician? What makes you say that? Here, I would suggest bring the color of their shirt if you want to.
The
The
patient
patient
is
is
the
in
red
the red.
one wearing the red shirt,
Yeah,
and the
Very good.
physician is the white one.
the white.
White one. Yes, good guess. Why? What makes you say this?
I think usually physicians wear white, right? And I think also his posture, the way he's
What
standing.
makes you
Yeah,
say this?
the body language.
The body language.
Yes,
The body language. The
body language.
confidence that the man is showing with by putting the hands in his pocket. A patient can't do that. A patient
Yes.
will be in pain, showing he doesn't know how he's standing, what he's doing. So that's the situation. Yes, the body language. Yes, a good thing. Any other comment, guys? Anything that you want to share? Because it's an important topic when it comes to phlebotomy. Everything matters. Kara, anything you have to say?
Sorry, about phlebotomy?
Yeah, the body language in the phlebotomy. Anything addition? No?
I wrote something.
Hmm.
Hang on now. I think your body language should always be open and welcoming and warm and confident.
Confident.
Yes.
Give the patient is good. Give the patient the confidence that you are there to do the proper job. When some people, when they come and talk, you know, the doctors, most of them, they're trained for this. So when you go to emergency, when the doctor comes, there's a different scenario. The way he talks, the way he approaches, I have noticed this. Right? So because now he's a trained professional working in that department. Now, as a technician, you have to be a trained professional to do your job. That's what it is, the bottom line. Clear?
Yes, clear.
Yes. Clear?
Yes.
Yes.
Okay. What to do if they are with someone? This is another thing. We already talked about it. If they are friends and families are there talking, and then the doctor says, okay, do the job as a phlebotomy technician or as a phlebotomist. They are talking, will you go there and say, I'll come again? It's a possibility to go again, but you have many things to do. You have to go to different wards. In that case, look for the atmosphere there. You can tell them, okay, I'm the technician today. I have to collect the patient's like blood. Can you please give some time for him? Let me do my job. They will just move out. If someone is asking from that side, asking too many questions, send them out. Very polite way. Would you mind if I can do this alone? Then they have to leave the room because some extra people who are there, they ask irrelevant questions, it makes the patient become more anxious. We don't want to happen. We don't want that to happen. Okay, you can do that. Because what if it's a stat situation? You need something that has to be tested right away, and the doctor is demanding that has to be, the result has to go to his computer within half an hour. You have to do that, right? Because it's stat. If the physician is inside, this is a situation where you have to leave, because usually the physicians are not that easy to be available around a patient. They're all the time busy. If you're going to get the blood, if you see a physician, leave them, because it's important. Or if the test demands a stat, something the physician has put at a stat, they will understand. Tell them politely, you're there to collect the blood. They will understand. The doctors are not going to bother, definitely. They will understand. Clear? And religious member, a clergy, or some other, what do you call them? We call priest also. So if they are there, just go. Maybe they are giving some spiritual advice that is needed for the patient when they are critically ill. So just leave them. And even in this situation, if it is a stat, request the priest that you're going to collect the blood. They will understand, right? Everyone will cooperate. Clear? What do you do if the patient is asleep? If the patient is sleeping, but you have to collect the blood, that's a demand. What will you do? Any idea? You will knock the door in such a way that the patient wakes up. Is it okay? No. I want to hear from you. What will you do?
No. No.
What will you do?
Gently touch the bed.
Touch the bed. Because if the patients, they won't have a proper sleep majority of the time. If they are given some medications, a different story. Otherwise, they'll be in pain or some kind of disturbance, something bothering them. So they will have an alert sleep. So if you touch the handle or anything, the rail close to the bed, they will open their eyes. Then politely, don't scare them, politely tell them, I'm the technician here. How are you doing? I'm here to collect the blood. They will understand. Okay? Do not turn on the lights. Just you enter, you turn on the light. No, for some, it's very sensitive. They may scream sometimes. They will scream at you. Can you please turn it off? We don't want to hear that because it's bothering them. They're already in a difficult situation. So it's hard. What about unconsciousness? You don't know the patient is unconscious, but you're entering inside the room and you see the patient is not waking up even after like calling him like politely. He may be unconscious. Okay. If you don't have the confidence to wake him up, go call the nurse. I will do that. I will definitely go bring another person to make sure nothing is wrong. Right? And when you start the procedure, talk to them that you are the technician, you're drawing the blood, even though they cannot respond. That's why I would suggest bring the nurse. A nurse should be there. Tell them you're going to do this, but the patient is not awake. So to make sure, like, can you be with me? Like, they will help you. You may have to ask a nurse or other healthcare professional to help, definitely, as they still may react to the needs. Sometimes this is a situation. You think they are like sleeping or they're unconscious, but if you poke, they may wake up, they may scream, or they can move the hand. So always make sure when you're not okay with the situation, you bring another person. Always, always safe. Clear? Uncomfortable positions. Sometimes you find patients in awkward positions. Okay, they're dressing maybe here and there, moved. So that's okay. You don't have to tell them anything. Don't bother them. Have an eye contact. Tell them if you can help them, because some of them, they have mobility issues in these situations when you're there to collect the blood. Always, always be courteous, show empathy, and be professional. Okay. Then you introduce yourself first. What if they are in the washroom? Just tell them that I'll be back. Okay. But make sure, tell the nurse when you go outside, I can't see the patient. I don't know whether the patient is in the washroom. Can you make sure? Because this is for your safety. If something happens, who went there? The technician went there. Did you find the patient? No. Why didn't you inform us? Clear? Okay. If they are naked, maintain eye contact. It's not their problem. They don't want to be in that situation, but it's their what do you call, the situation has made them like that out of some pain, distress, the condition of the body. And we are all human beings and we have to maintain the dignity. So show respect the same way as you show respect to others, even in the situation, because it's not their issue. It's the condition of the system. Something is bothering them. Something has affected them. So they don't know. Help them. Okay? Make them feel dignified. Have an eye contact in this situation. So as I told you, if you are working in a hospital, you will have different situations. As Munmun, she will tell you so many things. It's your job to remain professional, all the time be professional and treat patients with respect at all times. If you feel the patient is in danger, talk to the nurse. Sometimes there is a bell in the patient room. Just press the bell. The nurse will come. The nurse in charge will come. They will. What could be the danger? What could be the dangerous situation? The patient might have fallen down. One possibility, right? Fractured
Yes.
the hand or the leg, screaming out
Yeah.
of pain, right? In
Yes.
that case, don't touch them. Don't even touch them. Just press the bell. Why? Because if something is not right, oh, why didn't you call us? Who told you to do this? That doesn't come under the scope of practice for us as technicians. Our job is to collect. That's it. You will get a question in CSMLS. If a patient is there, the patients want to sit straight, and you are there in the room as a technician. What will you do? You will adjust and make the patient sit up, sit straight. What do you think?
No, call the nurse.
Call the nurse. Tell them, I'll call the person in charge. Who is the in charge person? Nurse. There'll be options. Tell the nurse, document it and make him sit straight. No, 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 no. Only if there is a problem with the venipuncture, document it. We are for that purpose. Who is in charge? Nurse is in charge. Tell them politely, I am here as a technician to collect the blood. And of course, I'll be helping you. I'll tell the nurse to come and take care. That's it. We don't want unnecessary headaches. Clear?
Clear.
Why?
Yes,
we are
clear.
not trained. We are not trained to handle those situations. Keep this in mind. It is enough if we do the phlebotomy job perfectly. Only we are trained for that purpose. Keep this in mind. And if there is any abuse towards medical professionals, will that be tolerated? No, no, no. Your institution is responsible to ensure all patients, employees, medical staff, volunteers in a safe and secure environment. So the environment is very important. Swearing, yelling, threatening, no good. You should report it immediately. If a patient or other family member is abusive during the collection, you don't retaliate. You don't talk back. Just pull the needle, go outside, talk to the supervisor or manager. Depending on the situation, sometimes they call security as well. They may call security if the other people who are there, if they are very rude, if they are offensive. Yes, it's a no, no, no. So you have to make sure this thing has happened and then they will take care of that. Okay. How will you recognize a patient is in distress? Can you recognize it if you're collecting blood? The patient is not comfortable. The patient is in some kind of pressure, distress. But the patient is not talking. How will you identify?
Body language.
Yes, and facial expressions.
Facial expressions, very good. Body language, right? Okay. What will you do in that case if you notice?
Again, call the nurse. If you notice
First,
something
pull the
unusual.
needle. If the needle is
Yes.
inside, pull the needle.
Exactly.
Because the test results will be different.
That's
There may
right.
be chances of hemolysis, because definitely you might have gone to the border of the vein. The needle is not inside, definitely. Or you might have poked somewhere other than the vein. That's even worse. It could be a sclerosed tissue, or it could be a scar that's there, or it can be the nerve. You pinched a nerve. Definitely they'll be showing some kind of weird expressions. Some of them they'll be making sounds, ouch, ouch, all these things. Okay, so be careful. But to some people, that the needle itself may be a problem because of the phobia, so they may show the facial expressions in a different way. That's why we ask, have you ever had blood drawn before? How was it? Did you encounter any problems? Rather than asking them, will you faint if I draw the blood? Will you scream if I draw the blood? That's not our business. You have to just ask them, make it even more simple. Have you done this before? Done. They will tell, oh, last time someone, I have heard these stories. Last time someone did, but they took it so beautifully. Either this statement or, oh my God, last time someone, I think they poked somewhere, they tried twice and, I was about to faint, be alert. All these things, they will bring up the stories. They will bring different sentences based on what they are telling. Pick those words, and then you do what you have to do. Take precaution. Okay? Now, the message has been conveyed to you. Something will happen if you don't do it properly. So make the position erect or make them sit straight. And if you are not that confident with the patient because she said I was about to faint, it means take them to the bed. Never know. Clear? You have to take all these steps. These are questions that are often overlooked to speed up the collection process, but they are very important. According to CLSI 2017, this has been mandated. It's a protocol for all the phlebotomists. Follow the same. I'll be repeating when you come to the sim lab. Most probably I'll be with you in the sim lab because I'm taking sim lab batches after batches. So definitely these questions are there. Why we have mandated in the college these things, because the next step is yours going out to some practicum site. The practicum site is a training for you as a phlebotomist. So you will be dealing with real patients. So we don't want any problems. Clear?
Clear.
Yes.
Now,
clear.
they guide us on how to adapt the collection to ensure the patient feels safe and comfortable. Then there'll be one complete discussion about how to do the phlebotomy on patients who have different veins, who are violent patients, this also, combative patients, arguing, rude, all those things are covered in the sim lab because that's the situation. You have to know what you're doing. Can the patient, for example, you have started the procedure, the patient was calm, like they are cooperating, but you have to collect 5 tubes. And then during the third collection, the patient is telling you stop. What will you do?
Stop.
Stop. Will you tell them like, okay, just 2 tubes. Can you bear with me? Is it okay
No.
to say that?
No,
No.
no.
Then, is it something hurting? I did something wrong? How do you feel? Is it okay?
No.
No,
big-
you
a
will not
big
say
no.
anything.
No, no,
Yes.
no, no, no. Oh,
That's
thank
wrong.
you. Sorry. Okay. That's it.
Yes.
But what do you have to do?
Document it.
Good job.
Document that you just get
Document.
2 tubes. Yes.
Document. During the collection of the third tube, the patient told me to stop, so discontinued. Clear?
Clear.
Okay, and then you have to say patient refused. Then if you're in the LIS, there will be a form which says that you will be putting the information about the patient in that page. There will be patient refused. You have to click that patient refused. Now you have to call the doctor, inform them. Okay, understood. So inform the doctor or inform the physician. Clear?
Clear.
Clear.
A patient will judge your ability to perform duties by our way of approach and appearance as well. Okay? And this we will be discussing when you come to the lab. I will have the cards. I'll be showing it to you. So we will be talking about it, not today, because this is not for your Friday test. This is for your final exam. I'm repeating. The unit that we are covering is very closely associated with the communication with phlebotomy. We will be seeing this next week in the lab, but this is not for your Friday test. Clear?
Clear.
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 So this cards I will print out and then we can see this next week in the lab. Any other question? Yes,
ma'am.
no.
All clear, ma'am. Thank you.
You're most welcome. When you go to 15, I will post the link today. Under 15, for the adaptive phlebotomy procedures, there is a table. How will you collect blood if it's a geriatric patient, pediatric patient, and all those things? Today, you're going and then you're filling out the table and bringing it tomorrow for revision because you will get questions from that activity chart. Okay?
Okay, thank you.
Okay.
Yes. Now, can you see this?
Yes.
This we are going to talk because it's very easy. Why we are discussing? Because when we are doing the phlebotomy, we may bend or we may be just putting across like this, grabbing the stuff. And this is very strenuous. So sometimes it causes body harm, body injury. So this is what we call the ergonomics when you become a phlebotomist. But when you are working in the core lab, like me, you will be sitting in front of the computer. So this is a brief discussion, what you have to do, how you have to perform. This is pretty much a practical one because you will be next week, you'll be in the lab performing different procedures. So this is just a quick discussion about how we have to sit, how we have to perform, what will happen if we don't do all those things. Any questions from the previous topic about communication?
No, ma'am. All good.
All good. So this,
Yeah.
you have this in the CSMLS guidelines, 9th edition. What is ergonomics? Ergonomics, the definition is important. The science of designing work with the worker in mind, which means you make a chair that's comfortable for sitting when you're working with the computer, is ergonomics. Okay, based on the task that the employee is going to perform, what are the arrangements that you have to make as an employer is a good thing in ergonomics. So you should know the definition. The science of designing work with the worker in mind. What kind of job he's going to do? Is it okay to make this chair for him? Is it okay if he'll be extending his arm like this? So all these things are very important. So that is what we call ergonomics. Look at the first picture. If there's a poor ergonomics, which means if the chair is not good, the person cannot lean a little bit like this on his back in a chair, it means it's not a good thing. If a person is working for 8 hours in the computer, these things have to be noticed. Based on that, they make the chairs. Why? Because they get sciatica problem, they get back problem, they get problem in the leg, problem in the hand, okay? And epicondylitis, repetitive movement, something like that, rupturing the muscles, leading to injury. All these things should be avoided when you're working in a lab setting. So what are the things that you can expect if something is not proper, if the chair is not proper, for example, and you're working in front of the computer? What are the things that can happen? Accidents may increase, injuries, eye
You'll get
strain,
back pain.
back pain, and then injuries in the mainly the hand. What I noticed, my hand here, it becomes sore, and I have this epicondylitis because of the repetitive putting the tubes in the analyzer. That happens in some jobs. Fatigue sometimes, right? And some disorders. What do you call the tunnel syndrome when you operate in front of the computer? The keyboarding mainly, this muscles get
Carpal syndrome.
Carpal syndrome, sorry. Not the tunnel, sorry, carpal syndrome. So these are the carpals, mean the small bones assisting in using the, what do you call, the keyboard. So repeated usage leads to carpal syndrome. Yes, good. Thank you. And then biochemical stresses. Some people, when they enter inside the lab, they'll be very cranky because they don't want to see all the time machines. If you find someone, then tell them go out, drink a cup of coffee, go out for 10 minutes. The supervisor will tell them. It's not their problem. Is they're frustrated because they're working on that repeatedly. So some people, they change the job. If that is the situation. They feel stressed, lowered morale, cranky, screaming, yelling, not having confidence, all these things. Musculoskeletal injuries, main factors in determining the risk. This majority of them, they have this, people who work in the computer sitting for long hours. Why? Because the postures might have been affecting movements, repetitive movements, the force that they're applying on the hand, it leads to musculoskeletal injuries. And here, look at this diagram. Height of the benches, right? It should be appropriate up to their level where you can reach. If it is too high, it's not good. It's a strain in there. You're straining yourself. Okay, it's no good. To some people, the table, usually the labs make everything with an adjustable setting. The table can be brought down. The chair can be lifted up. I use the chair that goes up and down. And reaching, stretching, twisting, everything is manageable by using the proper chairs, proper tables. And you don't have to all the time mix. For some, especially when you're in the hematology for the CBC tubes, you don't have to manually mix. You just keep it in the mixer like this. I will show it to you. It's there in the lab. It's called the Vertex mixture. You keep the tube, you just stand there, it'll spin and mix the contents. Just few minutes or few seconds, done. So Vertex mixtures. And for pipetting, don't use hand manually. We have the beautiful automatic pipette. Put the tip, suck the thing, and then dispose. Release the content.
The mixer, isn't it the mixer that we already have in the lab?
That is like that is a rotor. That is a rotor mixer. Vertex mixer, they're just giving example. We have
Okay.
the rotor. That's why we put the tube and then we keep working. Right?
Okay. Yes.
And accessibility and size of knobs, button. You don't have to twist a knob which is bigger than your hand where you cannot hold, because that will cause strain here, pain. Weight of some items, when they are heavy, bring the trolley, load it and take it. We have a trolley. Okay. And this is the pipette. You know, there's a beautiful name for this pipette, Eppendorf pipettes. It's also called micropipette. But what is the other name? Eppendorf pipette. I'll be asking you when you come to the lab. Note this down. Eppendorf pipette. Okay. And sometimes for some of the machines, you can operate using your foot. You know the garbage bins we have in the lab now? You just press the thing, something like, what do you call? There's something you press with your foot and then it opens the lid. It's a foot operated lid. Right? So all these things. And design of equipment, display monitors. Now, majority of the monitors, you don't have to look with the reading at the top with the line. There's a monitor. You just check the reading and record it. pH meter, for example. And then this chair. This is a very comfortable chair. And the chair should be like slip resistant. It shouldn't roll when you're working on the computer. You want to move something, you have to grab something. And at the same time, the wheels of the chair is rolling is not a good sign. That's why they have a special plastic sheet. Do you know that for the chairs, when you sit in front of the computers, there's a plastic sheet, and then on top of that, the chair will be sitting because it won't roll.
Yes.
Okay, you might have noticed. Lab stool and chair design. So even in the lab where I'm working, I'm not comfortable grabbing the tubes at the top because I'm not tall enough. I have to bring a stool which is comfortable, like a ladder cum stool, a small ones, to grab the things. Or I have to call a student who is tall enough to reach there and please take that for me, because it might be slippery. What if I just had something accident there? I can't come to the lab, right? And the chair should be of the adjustable seat, the angle. I can recline a little bit, right? Take rest. We call back rest. And then the wheels should be stable and should have 5 legs. Keep this in mind. 5 legs for a good chair. Should be clean. And we have to make anti-fatigue mats. There's something that's available, anti-fatigue mats. If you're standing in one place, we have that in Life Labs in front of the analyzers, because we have to stand and load. So we have the anti-fatigue mats. And look at this, how you have to lift. Allowing for frequent breaks from repetitive work. If you're lifting something, don't bend and lift. You'll get a back pain. You are straining your back. So bend like this, sit, bend and lift. Ask help, okay? When you want to lift something, if you can't. And heavier things should be stored at the bottom, not at the top, because what accidentally, if you want to grab something, what if it falls on top of your head? There'll be a head injury. We don't want accidents. The labs are very careful about these things. And this, how you have to use anti-glare. If you're seeing a video, it shouldn't be glary. Screen should be at your eye level, slightly lower. Okay, brightness and contrast should be good. Keyboards and the pointers, whatever you're using, there should be enough space in front, and you have to operate properly by resting your arms here in front. Okay. So the air quality should be good. Temperature should be proper. Humidity should be there. Fresh air should be there. We have the air purifier in the lab, so no worries. The noise should be low. What are the good ergonomics in the lab? For the good ergonomics, you have to train your body in a proper way. Everything proper, pipetting, microscope, computer workstations, everything. Okay? And frequent exercises, stretch your hand and do like this in front because it relieves the stress in your body. And if there is a muscle tension, when you stretch it, then it'll be relieved. Okay? Try this at home. And pipettes, we all know pipetting hazards. Okay, you choose the pipette that's good for you, right size. Okay, but whatever we are having here, we are just training ourselves. Best thing is the Eppendorf pipette. What is that? Eppendorf.
Micropipette.
Micropipette. The other name is micropipette. We'll be watching the video. Use tips that fit properly. I don't think this is a big problem if you're just getting trained, but on a regular basis in the lab, yes, you have to follow everything because it's not good. What about microscopes? You have to reach properly. It should be a little bit lower. The table should be lower, so you have to reach the eyepieces of the microscope. Okay, there should be a proper space for the leg. And you have to adjust the chair according to, usually we don't sit when we are focusing on the microscope because we are seeing only a little bit, and that doesn't come under the scope of practice if we go to the real lab. But for the technologists, they're sitting and looking for so long, the chair should be adjustable, and we have that in Life Labs. Okay, and you have to make the oculars fitting in a proper position. And if there is a glare from outside, use the blinds, take regular breaks. When it comes to the computer stations, have a proper adjustable chair. Height of the, repeatedly we are talking about that. The chair should support your back, your legs, your thighs. And yeah, in the front of the table, you should have enough space to rest your arm. And the monitor should be above the eye level or a little bit below the eye level.
Eye
What about
level?
the eye level or a little bit below the eye level? Okay. Take a break when you are in front of the computer. And this, can you sit like this to work in the computer? This is the very funniest
No.
thing I have seen.
No.
No. Now, what to do? This is the correct position. So look at the eye level, little bit low. Okay. Top of the screen is slightly below your eye level because you won't strain your eyes. There shouldn't be glare. Can you see the work surface on the floor? It's very clear. The legs resting properly. Feet should be flat. The lower back should be supported. Look at the forearms. It should be on the table properly. Shoulders should be relaxed. You shouldn't be tensed. Relaxed. So this is the proper way of using the table. So we have covered the topics that is relevant to the lab area as well as the phlebotomy area. So keep this in mind. When you come from break, we are going to cover the review parts, the revision or whatever we are going to learn from the test point of view. Anything that you need to cover once again, explanation once again, that if you need it, I can do it for you. But just let me know if this is okay, you have learned so far good, or am I fast, or I can go slow, I can neglect some topics, I can add some topics. Just, I want to know right now. From
Everything's
everyone,
okay, Miss
it's not
Epping.
like some of them telling yes, some of them telling no, it could be a little bit. These are the fundamental things, is very easiest thing that we have learned. Yes, Amina, go ahead.
That was a mistake. I wanted to do a thumbs up.
You make mistakes like this, take back. Take it back. Okay. Once again, Amina, Azinet, Christiana, Chris, Zarina Main, Eveline, Hoda, Joanna, Kara, Lewis, and Maris, Rugiatu, Santiago, Shabana, Verna, Yinghong, Yusra, Zenaida. Any questions, any doubt, any clarifications? If you need, I want the yes, Verna, go ahead.
Mom, I have a question about the activity from Unit 15. How are we going to do this? Are we going to answer this one?
Yeah, I'll be posting the link at the end of the session in the Teams. You have it there in the D12 for your
Yeah.
information.
Yes, Mom, we have it.
You have it. So you can pull that today evening. In that particular chapter, PowerPoint chapter, the adaptive techniques, you have the information. We talked about it. It's your duty as a homework to fill the chart and bring it tomorrow.
Okay, thank
You
you.
will get questions from this also, right? If I tell the answers, it's like spoon feeding. I don't want to spoon feed.
Yes.
Clear?
Okay.
So you have to spend some time wisely to learn that information. It's a break time, guys. Most probably we'll start revision today or any discussion. We have covered the test part. Also the final exam part a little bit. Also the practicum part for the lab. You can come here at 11:35. Is it clear? After
Clear.
the break.
Yes, ma'am.
We'll
Clear.
start
Yes,
revising,
thank you.
asking
Yes, clear.
questions. Okay? Revision, asking questions, and tomorrow total revision. So it will be comfortable for you. If you attend the test, you will be like, you'll have a good feeling. And my
Yes.
duty is to convey the message and make you learn comfortably. Okay? Have a nice break. See you.
Thank you.
Okay, Mom. See you.
Thank
Thank
you.
Thank you.
Thank you.
Evelyn.
Hi.
Hi, how are you?
Getting better, but I'm still on a steroid.
Yeah, me too. Like I get
Mm.
like my doctor gave me one of those thing that you put in the nose, it's like a puffer.
Nasonex?
Yes, and it helps
Yeah,
with the coughing. It helps with the coughing. So
true.
I started taking that last night. So yeah, I'm not coughing as much.
That's true. Me too.
Yeah, but it was lingering a lot.
Mm-mm.
Question, do you see where the activity is that you was talking about earlier?
Honestly, I haven't checked yet.
Oh, okay.
It's in Unit 15.
Chapter,
I
chapter 15.
It's in
Unit
Unit
15.
15, yeah.
Okay, let me check. Thank you. Okay, let me
You're
check.
very welcome. I didn't answer you.
That's okay. That's okay. I'm just gonna check right now. So 13 and 15, right? Okay.
Yes. 15. Yeah, it's quite this flu season. Thank God that I have the flu shot.
Oh yeah.
And
Yeah.
still, mm-mm.
Yeah. I know.
Yeah.
I don't understand how I can't print from here. I used to be able to print.
Oh, did you read the new announcement that they
What
made?
happened?
It said that we are not allowed to print anymore.
Really?
Yeah. I think you try to click the notifications in the D2L. Yeah, I read them this morning.
Oh, I'm not also aware of that. Where is?
Yeah, I just read them, and yeah, it won't allow us to print anymore.
Hi guys. I can't hear you. Can you guys hear me?
Is that your screen, Rogiato?
No.
Hi guys, I'm sharing something for you. Can you see it clearly?
Yes, miss.
Yes, you
Okay.
can see.
Thank you.
Yes.
Yeah, because we're not allowed to print anymore, so we can't even go and print.
Challenging.
So where did you send this? Is it sent to our email? Miss?
We cannot hear you, ma'am.
I muted, sorry. I'll be keeping this for half an hour by sharing, so you can go to the topics. You can recall if you know something, write it down in the notebook, okay? Because we have more time for revision. So after that, I'll be starting with the question review. But this is just a rough idea that what I'm expecting or what you will be expecting in the test, in case if you get a questions, like how you will collect when there is a scar, how will you collect when there is a burn. So all these things are there in the table. Clear?
Yes, Miss.
Yes.
Yes,
Okay, very
Yes,
good.
thank you.
But is there any way you can send this in our email?
Yeah, I can do that. But after 1:30, I will do that.
Okay, no problem. Thanks.
Okay, so you can work in the evening, but review the information just to have an idea. I'm just putting this here. Okay, it's your job.
Okay.
I'm helping you.
No problem. No problem. Thank you.
Yeah.
Ma'am, we can see your screen.
We're still on break until 11:35, right?
Yeah, but we can see her screen. For the
Oh,
You
okay.
have 10 more minutes. No problem.
Yeah. We can see your screen, ma'am.
Yeah, we can see your
Looks like
screen
those are the questions for the
for the
exam
test.
tomorrow.
Yeah.
Welcome back. I want to look for the attendance. Hi, how was the break?
Good, thank you.
Good,
You're
mom.
most welcome.
Good, Mom.
Amina,
Thank you.
Azinet,
You.
Christiana, Chris, Zarina Mine, Eveline, Oda, Joanna, Kara. Yes, Kara, hi. And Lewis. Good. Maris, yes, Maris,
Yes, ma'am. Good.
Rukiato. Good. Santiago.
Hi, Miss.
Hi, Shabana. Shabana. Where are you? Varna,
Here, Mom.
King Hong,
Here, Mom.
Yusra,
Yeah, yes, I'm here.
Zenaida.
Here, Mom.
Good. Shabana. Where is she? I want to hear from her. Attendance is important. Now, can you see something here?
Yes, mom.
Yes.
You see
Yes.
something like a table. What I thought, tomorrow we can do the review with the questions that we expect in the test, or for the final exam, a little bit of some questions will be from here in this chapter also. So in class now, I'll give 15 minutes. If you have any questions, go through the information that you have written or you have studied so far. If you have any questions, if you want to discuss more about that, you're most welcome. And after that, we are going to start this activity. This is the activity sheet. It's there in the D2L, but I just pulled this for you because this is like a revision, an important part for the exam or for the test, because this is where you are going to apply in day-to-day life as a phlebotomy technician or as a phlebotomist. So I want this to be discussed in the class. Okay? So we will talk about it, few points like what someone has to say, what you have learned so far. We have so many, I mean, what do you call the words that's been given here. And I want to know what you have understood so far, because this is an important topic. I want to know exactly what you have learned so far. Tomorrow, we can review with the questions and watch some videos. It'll be interesting. Just to relax and to study, but it's going to be a revision time completely tomorrow. And today is like a beginning of the revision, but this is part of what you have studied in these units so far that we have covered. And you will get questions from this on Friday as well. Why? Because even we are going to apply these types in the, when you come to the lab, when you have hematoma, we should know what to do, how to collect the blood. So I thought it's better if we talk in the class, bring the points. Okay? It'll be like a revision. Agree?
Yes.
Yes, mom.
Yes, no. Tell something. Yes,
Yes.
people who are responding, I appreciate. Zenaida, tell me.
Yes.
Agree?
Yes, Mom.
Yusra,
Yes, I agree.
Ying Hong, is Ying Hong there?
Yes, Mom. Thank you. Can you
We are
hear
doing
me?
revision. Do you agree?
Yes, thank you.
Ready? Yeah, I think her mic is having a problem. Verna,
Ready.
Shabana,
Yes, ma'am. Agree.
very good. Welcome back from the break. Santiago,
Hi, Miss. I agree.
Rugiato, you agree? We're going to
Agree.
discuss. Agree, Maris?
Yes,
I
ma'am.
know
I
Maris will agree. Very happy to be in the class, discuss with things. Okay, Louis. Yes, Kara, you agree that we talk about this in the class better?
I sure do.
Okay, Joanna,
Yes, ma'am.
Huda. Yes, where is Huda? Or in the class? Agree with that. We're going to discuss about the important points as a phlebotomist. Is not there? Eveline,
Yes, ma'am. Definitely.
Sarina Mine. Serena Mine is not
Hello?
here. Yes, hello, I can hear you. So, Chris,
Agree.
Christiana. Yes, miss, we have to talk in the class a lot.
Yes, agree.
Easy for revision. Azinath. Yes, miss, we
Agree.
will definitely talk in the
Agree.
class. Amina.
Agree.
Agree. So why? Because someone will be sharing important points, so we can keep this in mind. So based on this, we can do the review. So tomorrow, once again, there'll be a review. But I have a quick question for you guys. Have you done the activities like this before for every unit? I mean, as a weekly unit,
No, not
No.
for
No.
starting
No.
from
No, I
the
didn't even know we had
starting
these.
from the beginning about the tubes, there is an activity unit. Have you covered that? It should be in the beginning from 1 to 5, 1 to 7. There are so many activities that you should be covering. Munmun did this before?
I don't think
No.
we did.
haven't done that.
You never did this?
Yeah.
Not all the activity, just some.
Not all of
I
them,
think
only few you
I think
did.
some of it we did.
Some of them you did. You did the
Yes.
phlebotomy as a chart, the tubes, everything, the anticoagulant.
Sure of that, but I know from the beginning we did it few.
You did few
Yeah.
because
In the
the
form,
reason.
actually,
Yes.
in the form of a lecture, not this kind of format,
No,
but
like in the format
in
form. I'm
yes.
asking you in the
No,
format
ma'am.
form
Oh,
or
not
as a question and answer form. No?
Interaction, ma'am.
Just interaction in the
Some kind,
class,
yeah.
not
Yeah.
like an activity,
Kind,
like a proper activity of
exactly.
giving the question answer questions,
Yes.
and the next day you have to bring the answers, or like a table where you have to fill it in. So have you done these kind of activities?
No, we haven't done those type of activities.
Yeah, why I'm
Yes.
asking, because coming week we'll be in the lab. I can print the sheets, I can give it to you. So after doing the venipuncture, we can sit and then we can discuss about it. So this will be a helpful review for the final exam. You can keep this in your folder or binder, and then you can review this for the final exam. Some of them, they have really useful hints or tips where you can recall the information during the exam time. So this has to be done as a whole package. That's why I'm asking you. If that is not done, then I have to do that. I have to print out the sheets. I have to make a photocopy, and then I have to share it with you in the class for a better understanding and better learning for better grades. Agree?
Agree.
Understand?
Agree, ma'am.
Yes.
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 Understand?
Thank you.
Okay, because now I think I have to do that. If that's not done, I have to do that. There are so many activities that you have to know. Okay? And it'll be interesting also if we talk in the class, like when we see each other face to face, then we can talk a lot in the form of learning talking. Now, activity, this is today I brought this sheet in front of you because I'm going to give the topic. You go through the information, and then after for half an hour, I can give this, then I can take the information from you. But this is in Unit 15. So adaptive and challenging collections. You will get definitely questions from this because this is something which is considered really, really important. Using a textbook and in-class presentation, fill in the second column of the table. So first column has the small words that we have heard before, right? And how would you adapt the venipuncture collection based on the condition, or why collection in these sites should be avoided? Some of the things we have to avoid, we all know that. What possible effects will it have on the patient or test results? So the topics are here. The first one is this scars, burns, tattoos, or healing abrasions. Can you see the screen, all of you?
Yes.
Not so
Yes.
clear.
Yes.
Not
They're
so
quite
clear?
small. Yes, ma'am.
But small.
They're
Small.
small.
Okay, I can enlarge a little bit bigger. So can
Better.
this is
Better.
okay?
Yes,
Better?
miss.
Yes, better. Thank you.
You're most welcome. I'll send the link also. It's there in the D12, by the way. And I have to now, it's good that you brought to my attention. I have to print all the activities and give it to you because next week we'll be doing the venipuncture. We'll be talking about this. And with the coming week, once again, we will be online, but the topics that we are going to cover will be the IV. Okay. And that's a little bit like the information will be overwhelming to you. So many things you have to know. You're not going to do the IV, but you have to know as a technician what you should avoid when there is an IV. It's a good thing that they brought it in D12. We never had this opportunity to know this much. We just went in the practicum site and then we learned different things. It's good for you. So we have to review the information even after coming. And next week will be phlebotomy activity. And this is how we'll be doing. I told you one day I'll be showing the blood grouping. One day I'll be showing the ESR. One day I'll be showing the hemoglobin. So everything we are going to be busy, active learning. But when it comes to phlebotomy in that area, no yapping, no talking. I don't like that. Once when you sit in the chair, if you want to discuss, I will make you groups. You can sit as a group, you can discuss, you can come up with ideas as a review. Clear? Okay, the first
Yes.
one, because this is for your better learning, I have to do this. Because I'm telling you, I'll be here with you for 2 weeks. After that, I won't be seeing you guys for 2 weeks. Okay? And then I'll be back. By the time you'll be completing your final exam, so I don't want any disappointments. So you have to be thorough. I want my students to be really, really thorough in the topic when I'm teaching. Okay? So scars, burns, tattoos, mastectomy. What is mastectomy?
It's in the breast.
It's
Very
breast
good.
removal.
Breast removal. That's very good. What is hematoma?
Bruises.
Bruises, right? So we will be talking about this a little bit because next week again we'll be seeing these conditions. Sclerosed or hardened veins. Yes. Hearing impairment. Right? And visual impairment. Patient with dementia. What do you understand by dementia?
Not able to communicate.
Like a
or-
Not
memory
able to
loss.
communicate.
Yeah, cognitive issue.
Patient with rheumatoid arthritis. Will the draw be difficult? What do you think? What do you understand?
It's painful. There's a lot of inflammation. I would assume
Inflammation,
that
yes.
taking would be a little bit more sensitive.
Yeah, more sensitive. Okay. Young child. It comes under which category of phlebotomy?
Pediatrics.
Yes, Christiana?
Is it pediatrics you're saying?
I can't hear you. Sorry.
Sorry, you asked for young children, right? What category it comes under?
Sorry, guys. Try again. Someone can just tell what she
Just trying
explained.
to say pediatric.
Pediatrics. Yes, very good. I'm sorry. I cannot hear. I don't know what happened. Older child, 14 to 18 years. Normal venipuncture or pediatrics?
Adolescents.
Adolescents. Very good. What do you understand by geriatric patient?
Elderly.
Elderly people.
Elderly. Patient fainting during collection.
Syncope. Syncope.
Syncope. Very good. Syncope. Syncope. Some people say syncope. Some people say syncope. Okay. Can you think of any others? Is there something missing here?
Yes, ma'am.
Yes. Eveline, go ahead.
Yeah. As I've said, the patients with cognitive issues.
Cognitive issues.
Yes.
Cognitive issues. Yes, very good. Or developmental disabilities. Can we keep
That's
that?
right.
Yeah.
Yes.
Cognitive issues or developmental disabilities.
That's right.
Clear? So these are the topics. So I'm giving you half an hour. Okay? You just recollect or recall the information that you have learned in the presentation, or if you have a textbook, just go through the pages that we have learned yesterday and then collect the points. We'll be here in the class exactly at 12:30. So it doesn't mean that you can fill all the boxes or you can pick two or other person can pick two, but we can just mix the information and then we'll try to collect this as a useful review, because in the test on Friday, if you get questions from this, you can answer very well as an information. And also from the point of view as a phlebotomist, you should know these things. Okay, even next week, we are covering the sclerosed veins, hematoma, right? So all these things will be covered. And this is a review even for your final exam. Clear, all of you? So we are there in the class. If you have any questions, you can ask, so that usefully you will be reviewing the information, learning from the test or exam point of view. Agree?
Yes, ma'am.
Yes,
Okay.
agree. Yeah.
Go with the information. I'm here in front. Go ahead. First, start with the scars. What do you have a scar in the skin? How will you collect blood? So just go through the information and write the points in your notebook. So only Alexia is not there, so I want to know why. So I will message the college. Any news from Alexia, guys? Sorry to disturb. Please let me know. Okay. Thank you. I haven't received any message so far. Neither the college. How is it going, guys? So far, so good? Yeah. No, just I want to make sure like you're doing good, everything.
Yes, it's going good.
Okay.
Thank you.
Thank you. You have time, no worries. Yes, Inghang.
Yes, Miss. where can I find this sheet about the challenging collection on D2L? I think I need to review after class, please.
Okay, I'll send the link. No problem.
Okay, you'll send the link.
Yeah, I'll send the link.
Class or
Anyways,
class.
I'm going to send the link, but right now in the class, try to note down or write down the points that you can recall, so we can discuss in the class.
Okay, thank you so much, Miss.
Okay, guys, attention, please. It's 5. So for a few minutes, we are going to discuss about what we have learned so far. Okay, and this will give a clear idea even for me how far you're attentive in the class, what you're observing, how you're getting up to the point, or is there anything that I'm missing? Is there anything you're missing? All those things. Okay.
Yes.
Yes. So, okay, now we have the topics or words that we're going to talk about today. The first one is a scar. Who is willing to talk about that?
I can.
Okay. Okay. Give the
Um,
important tips or important information.
so,
Okay.
yeah. So a scar, like a site that is scarred, overly used, maybe from drug use or whatever, should be avoided and try a different area. If that's not possible, then you can always go to the capillary tubes or the
Very
micro.
good. Yes. Capillary or microtainer. Yeah, good point. I appreciate it. Thank you so much. The next one. What is the next one? Burns.
You want to avoid burn sites. If one arm is burned, you want to go for the other. If both arms are burned, then you want to use the capillary method of collection.
Very good. Capillary collection. So we agree with this, right? Better. Now, my question is for Lewis, right? If you are collecting the capillary blood, what kind of blood that could be? How to make it? How to make the collection the best collection when it comes to capillary one? There shouldn't be errors. There shouldn't be any erroneous results or altering the result situation. What will you do? How you will proceed? First, what is the nature of the blood that you're collecting? Venous blood also. Very good. Then? Mm-hmm. 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 Mm. 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 Mm-hmm. Microtainer, you collect the blood. Okay. What about the first drop of blood? That's a good information. What about the first drop of blood?
Wipe it.
Wipe it. That's what I want to know. Why wiping the first drop? As you said, there'll be a bit of venous blood, capillary blood. Not only that, we wipe it because there will be cellular fluid or intracellular fluid or interstitial fluid. That's the word that we use. Okay. So we don't want the fluid to interrupt or disturb the results. Good job. Now, heel puncture is a different puncture. Capillary puncture goes mainly with the finger. Clear?
Yes, ma'am.
Yes.
Yes, ma'am.
Lewis. Lewis, is it clear? Okay, next. Can we go to the next person who is ready for tattoos or healing abrasions? Tattoos. Yes, Amina, go.
So tattoos and healing abrasions can be very painful. So there are sites that must be avoided and they are prone to infection. It would be advised to use another side of the, like maybe the other arm, if there are no such conditions on that side. And if the two arms have such conditions, then you have to adapt to another technique entirely to get the blood.
What is the another technique?
You can use the capillary.
Capillary. Once
method.
again, we are landing on the capillary, right?
Yes.
Okay, very good. Usually the heel puncture is performed on the babies, infants, because of the sensitivity of the hand. Some of them is not really good. It may puncture the bone and it will be infected, and we want to avoid the all those situations when it comes to pediatric collection. So capillary puncture usually is not done on the pediatrics, only on the adults it's performed. For pediatrics, we use the heel puncture. Okay, clear? Why I'm repeating this? Because I don't want any anything concept that's not clear for you when it comes to the test, from the test point of view or exam point of view. I'm very specific about it. Santiago, go ahead.
Hi, Miss. Sorry, I just have a question. So, what if the patient that you have to draw blood from is really heavily tattooed? Like, I'm talking like hands on both of the what's it called?
The forearm up until the wrist, you mean?
Yeah, let's just say they have sleeves on both arms covering the what's the site called again? Where we usually draw blood.
Antecubital area. Or
Antecubital fossa, that's it. So let's say both antecubital fossas are covered, and for some reason, like the puncture site where you collect from the capillaries on your fingers.
You're talking to me. I had the toughest draw. I already mentioned yesterday in the class with one patient, but the patient luckily was so cooperative. She followed what I said, but that was really a hard puncture. I can collect blood from the deep vein and the other things, even from the rolling veins, I know how to do. But the tattoo thing, my mind never recorded the area. And sometimes even after palpation, you find the vein, but it's very hard to imagine and to assume that where the vein could be. It was that tough. So go for a capillary puncture, write a note.
Okay.
But some people are good in that. My senior was so good, and then she can draw blood even from the tattooed thing. I don't know how she records the information here, but she's experienced. Very like 18 years experience. Maybe like we gained that out of experience, but it's harder for me also. It's a tattoo. It's a good thing. Yes. Next, mastectomy.
I will.
Asinet, yes, go.
Okay, so the mastectomy is that you never collect blood from the same side where you have that operation.
Yes.
Because of the lobe, the lymph lobe is often being removed. And if it's like both side, like both breasts, you can contact the physician. But you never collect. But it's one of those ones that is can be very harmful to the patient.
It's harmful in the sense that they are prone to infection, and it's very hard. It's painful for them, right? So better avoid. And the next one. Yes, good job, Asna. Thank you. The next one. The next one is very familiar to us. No one is going to say about this term?
It's a pool of blood where we...
Another person.
Okay.
Thank you, Asnath. Give others an opportunity. Come on.
Yeah,
Thank
basically
you so much.
what
Yes,
Asnet
Christiana,
said.
go ahead.
Yeah, it's basically like a pool of blood in the arm, or a bruise, you can also say, in the
Sorry,
arm.
Christiana, I cannot hear you. The others
Oh,
can
no?
hear?
Yes, we can hear.
Oh,
Yes, we can hear.
okay,
Can hear
sorry.
clear.
Okay, continue. Yes.
Yeah, what Asnet was saying is pretty much correct. Like it's like a pool of blood in the arm, like a bruise in the arm. And that is a place where it should be avoided for venipuncture. Always try to look for the other side, maybe the other arm would be best, and not to puncture that same site because it's already bruised. You're not going to get any good
Sorry,
blood
Christina,
collection.
your voice is breaking.
Oh.
So when you talk, let some other person can transfer the message to me. Okay? It's okay.
Okay.
I'm
She was
so
just pretty
sorry.
much saying.
Yes.
She was just
sorry about that. Yeah. Yeah.
Sorry.
I'm extremely sorry. I don't know what happened. The voice is breaking. But I can hear, and some of them by lip movement I understood, but just to let you know. Okay, good job. Go
Okay,
ahead.
someone else
Continue.
can speak. Sorry.
Maybe you can try again. Maybe check
Yeah,
if
what
your
she was
mic is okay.
explaining was she was saying that it's a pool of blood or a bruise.
Yes.
And you don't want to get blood from there because the sample will be contaminated.
Very good.
So
With the blood clot, yes, very
yes,
good.
the blood clot, yeah, and it can be hemolyzed.
Very good.
So you
the
look
test
for another
results won't be accurate.
inaccurate, yes.
And not only that, it will be painful for the patient also. Right? And third point, sometimes you won't get the proper flow because it will be blocked. 3 things. Yes, good job. I appreciate it, Christian. I'm so sorry for the breaking of the thing. I'm so extremely sorry, but the points are good. Next person, sclerosed veins. What does sclerosed means?
Hardened veins.
Hardened veins.
Yeah, Amina, Asina, those who have spoken already.
Sorry.
No. Yeah, I want the other person to talk. Santiago, whoever wants to talk. Yes, Zarina, might go ahead. What does sclerosed means?
Sclerosed veins is commonly found for the older patients, the elderly, the geriatric patients.
I can't see you.
I'm here.
Is she talking?
Yes. Can you hear me?
Explaining?
Yes. Can you hear me?
She's talking.
Can anyone hear me?
Okay, let her talk. Someone can say because her voice is also breaking.
Okay.
Where are you? You're not even in the front of the camera. Sorry.
I'm here. It's just my internet. I think it's slow.
This is learning experience, guys. Internet breaking. Yes.
Internet is slow, so
okay, that's
it's not bringing things in real time, I guess.
So I'm having hard time this week. On Monday it was like that, and today, just now, before that, I was able to hear. Yes, Varna. Okay. Okay, Varna. Next.
Thank you.
What is that? Yeah, that's okay. Christiana, I understand. Thank you, Amina. It happens. This is the technology. Technology issues. Okay, anyone can just explain it to me, what she said? What is sclerosis? Yes.
Can you hear me?
Yeah, I can hear you. What is sclerosis? You have to unmute to talk. Anyone can explain? Yes, go ahead, Rugiato. I can hear you.
My computer's. Can I log out 1 second and then log in again?
Okay, that case, some other person can talk. Sclerosed veins, what she said. Santiago, can you try sclerosis?
Yeah, sure. I'm not fully I don't fully know that concept to review, but if I'm not wrong, sclerosis is like when the vein is hardened. and it's very difficult to insert the needle within there.
Yeah, very good.
Very common amongst drug addicts who use needles.
Yes, yes, very good.
And that's as far as I know with that. I have to review a
Okay.
little bit more.
So
Also, the elderly I found to have
yes, the elderly will have this. Yes, very good. Thank you so much. I appreciate, guys. So you guys are learning, huh? Doing revision. Good job. It's a challenging site for phlebotomy, especially when it comes to the geriatric patients. So you should know these definitions. Geriatric, pediatric. Okay. Do you remember the balance that I talked about? That's called bariatric. Bariatric. Okay. Yes, Shabana.
It's just a follow-up question to the same, the sclerosis veins. What if the veins harden? So, what other method should we use?
Pick any other vein that where you can insert it. And
Okay.
for mainly for the geriatric patients, if the sclerosed veins will be all clear, visible, you can palpate. But the thing is, it's hard. You cannot insert. It's painful for them.
It's painful.
It's painful for them. To avoid that, capillary puncture. What else?
It and like it's usually not bouncing either, right?
Not bouncing. It
Yeah,
won't
they're
be
very-
having
yeah.
elastic. It's gone. So
Okay.
capillary
Or a
method. Because for
butterfly,
them
ma'am.
also, their job will be easy. Our job will be easy. It's very painful to draw the blood from old patients.
Okay.
It's very hard.
What if we use the butterfly method? Is that
Yes,
That also
butterfly.
you can use, but
Yeah.
sometimes even with the butterfly, what if the collection is a little bit slow? Because you know, for the sclerosed veins, the lumen also will be less, very, very narrow lumen. So the flow may be blocked, even if you get a little bit using the butterfly. So the better the collection can be, the what do you call the capillary? Yes.
Thank
It
you.
depends. Yeah, you're most welcome. But remember, for the old people, even there'll be like the lumen will be very, very narrowed. It will be very less
Sure.
space inside for the blood to flow. Okay, good. Hearing impairment, what will you do?
Write it on a note or use hand gestures.
Hand gestures. Other person, please. Thank you.
Yeah.
Yes, Evelyn, go ahead. Mm-hmm.
Yes, ma'am. For patients with hearing impairment, we speak
You're
clearly.
talking, you cannot hear. I'm sorry, guys. For those who are talking, the others have to tell. I'm so sorry for few of them.
I can describe.
Evelyn, try muting and unmuting yourself again. For some reason, that seemed to work with me.
Okay.
It's okay. I have
Unmuted.
unmuted.
Okay, Evelyn,
Can you hear me, ma'am? Can you hear me now?
She is talking.
Yes, I
I'm
am.
sorry.
Okay. Actually, for patients with hearing impairment, there are
The
two ways.
voice is breaking here and there for me. It's okay. You can continue. Someone will talk. This is a talking session.
Yes, okay. There are two ways to approach the patient with hearing impairment. We speak clearly and slowly. And if that is not possible, usually with the patient with hearing impairment, they are with somebody. And the caregiver or a relative can explain to them better than what we are trying to do with them.
Yeah, good job.
Thank you,
the
ma'am.
thing is, I want someone to explain it to me. Shabana, go ahead.
Yes, ma'am. Actually, there's one more way you can, in case like you're not hearing us, there's a live caption option in the button. It says more, and if you go there, click it, go to live captions, it would actually write out everything you're saying.
Mm-hmm.
Then you can see that. I think that would help. But of course, I can say what she said as well.
What is that? Can you say?
Of course.
So okay, I'm in more now. I have record and transcribe, meeting info, video effects, language and speech settings. Language and speech, so I can. Oh,
it says live caption. So whatever.
Oh, so it can type. Okay.
Out in case you can't hear us.
Oh, okay.
Yeah.
So what does the thing give the important information that what she said for hearing patients?
She said, usually with the patient with hearing impairment, they are with somebody like a caregiver or a relative who can explain better.
Explain, okay.
Yes, or like I said earlier, Evelyn also brought that up. You can describe it or write it down on a note.
Okay.
And like there's more
Show
than one.
it to them. Yeah, they can read. Very
Use
good.
the visual actions.
Yes. So who can go for the visual impairment? Yes, good job. Thank you. Visual impairment. Just 1 or 2 points, important points. Yusra, go.
Yes, do you hear me?
Yes, Yusra, go.
Yes. For the visual impairment, right?
Mm-hmm. What happened to your mic? Once again. What's going on? Yusra, can you speak?
Yes, hello. Yeah, yes.
Yes.
Do you hear me?
Rugiatu, we can't hear Rugiatu. Are you hearing Rugiatu?
I can hear her.
Yes, miss. I can hear
Do you
her.
hear me? Do you hear
Okay,
me?
thank you. So visual impairment, what's the best option that you can
Yes, do you hear me now?
provide? You can scream at them or you can talk loudly. No, talk in the calm pace and explain the procedure. Okay? Okay. So these things we can talk later. Visual impairment, patient with dementia, rheumatoid arthritis. Okay? Older child, this we can talk tomorrow as a continuation of revision. Sorry about this, guys. I have to. Yes, Shabana, you raised your hand. Shabana's not there. Who else can talk? I can hear. Can you
Sorry,
unmute?
Miss, my teacher. Oh, sorry, my son kept coming in and I had to bring him to his room.
That's okay. As long as I can hear you, I'm happy. Okay, guys, so we have few topics left. Cognitive syncope. Syncope is a very important topic because fainting procedure, I'm going to cover this in the sim lab. What are the techniques that we're going to follow? So there's no rush. You have ample time to prepare, to revise. We're going to just calmly, slowly, we're going to do the revision. Even tomorrow will be fully revision. Okay? So on Friday in the test, I want everyone to get high five marks, even for the final exam. I believe everyone focused. I really appreciate. Okay, you guys are so amazing, so attentive. So if you have anything to say, Miss, you are running so fast like an express, I can slow down like a passenger. Or if you want really to, I can go faster than this because there are different students who have different way of learning. I appreciate your focusing on your work. And today I'll be posting this. I'll be sending the link, the same link, the table one to you in your team chat box. And one thing I would like to tell you, next week, I'll be printing all the activity sheets that we have to discuss in detail that we haven't covered so far from the beginning. They are all very important for the final exam point of view. We'll be doing that also. I'll help you. Okay. Have a wonderful evening. Look for the link at about 2 o'clock because I have a meeting, important meeting I have to attend, and then I'll post it. But you have the idea what is expected. Just you have to transfer the information. Keep it in your record for future reference. Even for MLPOW exams, CSMLS exams, these things will help. Good. Okay. Thank you so much. I'm sorry about it for the internet issues. It's not in my hand. Okay. Have a wonderful evening. We'll do the revision tomorrow. Revision. Okay. Good job. Thank you so much.